Hey there! Imagine a world where doctors perform surgery with robotic arms, where artificial intelligence helps detect diseases before symptoms even appear, and where virtual reality is used not just for games, but to train surgeons and treat patients. Sounds like sci-fi, right? Well, it's not. This is the real world of modern medical technology, and it's happening right now. Today, we're diving deep into the life-saving innovations that are changing healthcare as we know it. A new era in medicine. For years, medicine relied heavily on human hands and intuition. Doctors made decisions based on what they could see, hear, or feel. But now, technology's stepping in as a powerful partner, enhancing what's possible and allowing healthcare to be faster, smarter, and more personalized than ever before. Let's take a closer look at the incredible tools shaping this new era. Medical robotics, precision at a whole new level. One of the most exciting transformations is happening in the operating room. Robotic systems like the Da Vinci surgical system are now assisting surgeons with procedures that require extreme precision. Imagine a surgeon guiding robotic arms to perform delicate operations through tiny incisions, while seeing everything magnified in high definition. The result? Less pain, quicker recovery, and minimal scarring for patients. But robotics aren't limited to surgery. Some hospitals are already using robots to deliver medications, clean rooms, or even assist patients with mobility. There are wearable robotic exoskeletons that help people walk again after spinal injuries. And in the future, we could see microscopic robots traveling through our bloodstreams, delivering medication exactly where it's needed, or even repairing damaged cells from the inside. It's like having a tiny team of surgeons in your body, working silently, precisely, and nonstop. Artificial intelligence, a new way to think about diagnosis. Now let's talk about artificial intelligence, the digital brain that's transforming how doctors detect and treat illness. AI can scan medical images like X-rays, MRIs, or CT scans and spot signs of disease faster and sometimes even more accurately than doctors. It's already helping catch cancers early, identify signs of stroke, and detect lung infections before they become serious. But it doesn't stop at images. AI analyzes massive amounts of patient data to predict who might develop a condition, even before symptoms occur. It can suggest personalized treatments based on a person's medical history, genetics, and lifestyle. In some hospitals, AI chatbots help patients describe their symptoms, book appointments, or get reminders to take their medication. It's like having a medical assistant in your pocket 24/7. Of course, AI doesn't replace doctors. It supports them, giving them better information faster so they can focus more on the human side of care. Immersive tech, healing through virtual and augmented reality. What if you could learn to perform surgery without ever touching a real patient? Thanks to virtual reality, that's now possible. Medical students are using VR to step inside simulated bodies, practicing procedures again and again until they get them just right. It's safe, cost-effective, and incredibly realistic. Then there's augmented reality, where digital information is overlaid onto the real world. Picture a surgeon wearing smart glasses, seeing a 3D model of a patient's organs layered over their body in real time during an operation. It helps them navigate complex surgeries with greater accuracy and confidence. But immersive tech isn't just for doctors. Patients are using VR to manage pain, cope with anxiety, and even overcome phobias. Some burn patients wear VR headsets during treatment to escape into calming, icy landscapes, helping them feel less pain. Others use it to prepare mentally for procedures by experiencing them virtually before they happen. These tools aren't just cool, they're making medicine safer, smarter, and more human-centered. Wearables and remote monitoring. Your health always within reach. Gone are the days when healthcare only happened in hospitals. Today, it's on your wrist, in your pocket, and maybe even built into your clothes. Wearable devices like smartwatches now track your heart rate, sleep, oxygen levels, and activity in real time. More advanced medical wearables monitor things like glucose levels or heart rhythms and send alerts if something goes wrong. And with remote patient monitoring, doctors can keep track of patients from miles away. A person with a heart disease, for example, might wear a device that sends daily data to their cardiologist. If anything looks unusual, the doctor can step in before there's an emergency. This is especially powerful for people with chronic conditions or those living far from hospitals. It's convenient, cost-effective, and it puts patients in control of their own health. But, of course, it also raises questions. How accurate is the data? Who has access to it? And how do we protect people's privacy while using these powerful tools? Genomics and personalized medicine, tailoring treatments to your DNA. What if your doctor could design a treatment plan based on your DNA, knowing exactly which medicine works best for your body, with fewer side effects? That's the promise of genomics and personalized medicine. Thanks to rapid advances in genetic sequencing, doctors can now analyze your genes to understand your risk for certain diseases, like cancer, heart conditions, or even how you might respond to specific drugs. It's not just about treating disease anymore. It's about preventing it before it starts. In cancer care, for example, genetic testing helps identify specific mutations in tumors, allowing doctors to choose therapies that precisely target those mutations. This kind of precision medicine leads to better outcomes and fewer side effects, because treatments are no longer one size fits all. Even in everyday healthcare, genomics is beginning to shape how we think about diet, exercise, and lifestyle. Some companies now offer DNA-based health reports that help people make smarter choices for their own bodies. And in the future, gene editing tools like CRISPR could one day correct genetic disorders at the source, offering hope for conditions that were once considered untreatable. It's a shift from reactive medicine to proactive care, deeply personal and deeply powerful. 3D printing, custom care like never before. If you think 3D printing is only for plastic toys or engineering prototypes, think again. In medicine, it's being used to create highly customized tools and treatments. Doctors can now print exact replicas of a patient's organs using data from scans. These models can help them plan surgeries down to the smallest detail. Need a joint replacement or dental implant? It can be 3D printed to perfectly fit your body. And the future's even more exciting. Scientists are already using living cells to bioprint tissue, things like skin, cartilage, and tiny blood vessels. Someday, we may be able to print entire organs for transplant, solving the worldwide shortage of donor organs. Even prosthetics are getting a 3D upgrade. Now, custom designed, lightweight, and more affordable than ever before. This is personalized medicine at its best, tailored to you from the inside out. The ethical side of medical tech. With all this innovation, there's a lot to think about. What if AI makes a mistake? What if the technology is only available to the rich, while others are left behind? How do we keep people's health data safe from hackers or misuse? There's also the risk of losing that human touch. As we bring in more machines, we have to make sure patients still feel seen, heard, and cared for by real people, not just screens and sensors. And then there's the workforce. As machines take over some tasks, how do we support the doctors, nurses, and caregivers whose roles are changing? These questions don't have any easy answers, but they're important. Because for all its promise, technology must always serve one goal: to make human lives better, not more complicated. The future is now. Medical technology is evolving at lightning speed. What once sounded like science fiction is now part of everyday care, and the pace isn't slowing down. We're seeing robotic surgeries, AI diagnostics, virtual reality therapy, wearable health monitors, and even 3D printed organs. Each breakthrough is helping us live longer, heal faster, and care for more people with greater precision and compassion. But even in this high-tech future, the most powerful tool in medicine will always be the same: human connection. The kind word, the listening ear, the gentle touch. Those things can't be replaced by any machine. So, as we embrace this exciting future, let's carry forward both innovation and empathy, because when technology and humanity work together, there's no limit to how many lives we can save. So, the next time you visit a doctor or hear about a medical breakthrough, remember, We're living in an era where technology isn't just supporting healthcare, it's transforming it. From robotic surgeries to DNA-driven treatments, the future of medicine is already here, and it's only getting better. Thanks for watching, and stay curious, because the world of innovation is just getting started.